Hello, my name is Tony Scione, and welcome to the inaugural edition of In the Spotlight for the American Journal of Obstetrics and Gynecology. This is one of the many new initiatives for the journal, and we welcome your feedback. In this feature, each month, a different editor or associate editor will identify an article and perform a brief and focused review of an article in that month's journal. This emphasizes the commitment of the journal to create innovative ways to engage and inform our readership. Today, we will be reviewing an article from the March edition of the journal entitled Patterns of Recurrence of Postpartum Hemorrhage in a Large Population-Based Cohort by Oberg et al. The incidence of postpartum hemorrhage has increased over the past decade, which is often attributed to increasing maternal age and an increasing rate of obesity. Furthermore, the risk of recurrent postpartum hemorrhage appears increased in subsequent pregnancies, but this association has not been adequately studied. Identifying women who are at increased risk for recurrent postpartum hemorrhage would be advantageous for several reasons. The ability to refer to a tertiary care facility, proper counseling, proper intravenous access, and the availability of blood products. In this report, they used the Swedish Birth Registry, which has been collecting data since 1973, containing 96 to 99% of the births in Sweden. Patients were identified using ICD-10 coding. Postpartum hemorrhage was defined as blood loss of greater than 1,000 milliliters. Severe postpartum hemorrhage was defined as hemorrhages that led to a coagulopathy or required a blood transfusion. There were a total of 914,939 deliveries, of which 1.5% were multiple gestations. Overall, the rate of postpartum hemorrhage in the first delivery was 7% versus 5.5% in subsequent deliveries. The risk of postpartum hemorrhage was increased with older maternal age, presence of maternal diabetes, presence of maternal hypertension, presence of maternal coagulopathy, and the presence of maternal fibroid tumors. The risk of postpartum hemorrhage after a pregnancy complicated by postpartum hemorrhage was significantly increased. If a patient had a postpartum hemorrhage in a previous pregnancy, her risk increased by threefold of having a subsequent postpartum hemorrhage. If she had two postpartum hemorrhages, the risk increased to over six-fold for another postpartum hemorrhage. The etiology of the primary postpartum hemorrhage was important in determining recurrence. If the cause was due to retained products, the risk increased by tenfold for the same cause. And in women with atony as their cause, it increased by sevenfold. Interestingly, multiparity and living alone decreased the risk of subsequent postpartum hemorrhage by approximately 20%. For the clinician, this report adds to their clinical acumen. Women who have diabetes mellitus, hypertension, a coagulopathy, or fibroid tumors have an increased risk for postpartum hemorrhage. Most importantly, women who have a postpartum hemorrhage are at a significantly increased risk for a subsequent postpartum hemorrhage, and the preceding cause is likely to be the culprit again.